Hi, my name is Lisa Brideson-Glynn. I'm a pediatric speech pathologist, a certified oral motor therapist, and a feeding specialist. Thank you for joining me today on this mini lecture on bruxism, or more commonly known as teeth grinding. So I guess the first question we need to ask is what causes teeth grinding? And there are several factors that can cause a child to engage in teeth grinding. There could be decreased intraoral sensory awareness in the mouth. There could be poor muscle control function in the mouth. Stress, environmental stress. And also it could be because of a sensory processing disorder. When we think about teeth grinding, we think about the input that the jaw muscle, the masseter muscle, receives on a daily basis. We bite, chew, and swallow 1,000 times a day. During the biting, the chewing, and the swallowing, the jaw muscle is receiving both sensory input and motor input. When food is placed in the mouth, food is placed in the front, and then the tongue takes over and moves the food to the back of the mouth where the jaw muscle is. Think about if a child cannot move their tongue effectively to get the food to the back, and food is being chewed or masticated in the front of the mouth. This can then cause a deviant motor pattern in the mouth. So then the jaw muscle is not receiving both the sensory and motor function it needs. Thus, what happens, children then grind their teeth because they want that sensory input. So how do we treat this? I treat bruxism through several different modes of therapy. The first is therapeutic gum chewing. I take a strip of gauze and I place a piece of gum at the end. I like to use the Icebreakers gum because they're also highly flavored. And then I securely wrap it. I place it at the first back molar where the jaw muscle is and have the children bite and release. Now, some children can only bite and release one time. So then I'll work up to 10 bite and releases. And what happens is a couple things. The jaw muscle is getting the sensory input, but we're also working on building the tone in the jaw. And we're working on the tongue being able to lateralize and hold that piece of gum in the back of the mouth. Another exercise that I like to engage a child in is a frozen fruit exercise. I'll have a parent cut up small pieces of fruit and we freeze it. So it could be blueberries, watermelon, strawberries. And then again, I place it in a strip of gauze, securely wrap it, and place it at the first back molar. Again, I'll have the child bite and release so that the jaw muscle is getting the sensory component, and they're also getting the muscle involvement, the motor function. The tongue also still has to work in order to anchor that piece of fruit to the back, although I do have it wrapped in that piece of gauze. Another exercise that I like to use is vibration. I'll put a handheld vibrator right at the position of the jaw muscle just to give some sensory input into that muscle. I also will use a therapeutic feeding approach with a child who is grinding, and I'll look at the child's diet and we'll try to cube food into small pieces. So I generally use a postage stamp as my point of reference, and I'll either use a 2x2 piece of food or maybe a smaller piece and put it at the position of the first back molar, so that the child will have to chew the food in the back of the mouth versus chewing food in the front of the mouth. I hope you enjoyed the following videos on the exercises that I just explained to you, and that you'll have a better understanding of how to treat bruxism. Thank you. Did you want more? More. Let's do this first, then we could do more. Hands are quiet. Nice. Okay, we're going to do the lips now. Hands are quiet. Thank you. Nice. One more time. You want a cookie? Okay. One more time, and then we can have a cookie. Okay. Gauze. And we bite. Beautiful. Nice. Okay, I want you to bite. And I will give you a hug after, but first we have to work. First work and then hug. Okay, so we're gonna bite. 2 bites. Bite. Good. And bite. Good. Try it on the other side. Move it. Bite. Good. And bite. Nice. Beautiful. Okay, you get that. First bite and then hug. I like how you're tapping me. Bite. Good. Karina, that is beautiful. Good. Love those 2 bites. Good. The same on the other side, and then you get another hug. No. First work, then hug. Thank you. Bite. Nice. Wow.